Do you have pain at the level of the elbow over this area? The pain is a lot worse when you move your wrist in this direction. Let's talk today about tennis elbow. So people who use their arm, especially this movement with their wrist or rotational movement, such as painters, plumbers, electricians, people who use a screwdriver, tennis players, all of those people can irritate the tendon. And the tendon can be irritated, causing inflammation, or even can get to the point that will be a tear in the tendon. It produces pain. The pain is severe over this area. The pain is a lot worse with extending the wrist in this way or any movement of the wrist. Now, the diagnosis is essentially clinical diagnosis based on the clinical history, based on what the patient does for a living, and based on the clinical examination where the patient has severe tenderness over this area. The tenderness increases if you extend the wrist this way or if you do this rotational movement. Rarely that we would go to an X-ray or an MRI if the patient does not respond to conservative therapy, or if we suspect that the patient has any fracture or a spur or a tear. Now, the treatment, we start stepwise treatment. We start with medication, anti-inflammatories such as ibuprofen, naproxen, diclofenac. We use Voltaren gel. In addition, we add physical therapy. We add heat to the area. If the patient does not respond to the conservative therapy for a few weeks, then we move to the intervention. The intervention, we use injections. I avoid using steroids, as some physicians will inject steroids. Steroids, if you inject it in the tendon, there is an increased risk of tendon rupture. So I use platelet-rich plasma. I take blood from the patient, isolate the platelets under ultrasound. I inject it in the tendon and around the area. If the patient has a tear or has severe symptoms, I might go to stem cell therapy, especially bone marrow-derived stem cell therapy, in addition mixed with the platelet-rich plasma. In severe cases, if the patient does not respond to any of these therapies, or if the patient has severe tear, or they have calcifications, then we might go to surgical intervention. Thank you.